Empyema, a serious pleural infection with a tuberculosis perspective. I will be discussing empyema, a serious condition where pus accumulate in the pleural space, the area between the lung and the chest wall. If untreated, it can cause significant respiratory distress and complication. While bacterial pneumonia is the most common cause, tuberculosis remains an important cause of chronic empyema, particularly in the developing countries like India. So let's explore its causes, symptoms, diagnosis, treatment and prognosis with a special focus on tuberculosis related empyema. So what is a empyema? Empyema is a collection of pus in the pleural cavity, usually following a lung infection. Normally, the pleura or the pleural space contains a small amount of lubricating fluid, but in empyema, infection causes an abnormal collection of infected fluid and pus, leading to inflammation and breathing difficulties. If left untreated, empyema can progress to fibrosis, lung entrapment, that is it cannot function properly, and severe respiratory impairment. So what are the causes and risk factors? The most common cause of empyema is bacterial pneumonia, particularly due to the organism like Streptococcus pneumonia and Staphylococcus aureus. However, tuberculosis is the major cause of chronic empyema, often resulting from untreated or poorly managed pulmonary tuberculosis. So let's discuss other causes also. It could be post-surgical infection, for example, after lung surgery, chest trauma leading to infection, lung abscess rupture into the pleural space, and the risk factors are recent or recurrent pneumonia, weakened immune system, the condition like diabetes, cancer, HIV, malnutrition, chronic lung disease like COPD, bronchiectasis, tuberculosis, especially chronic tuberculosis empyema, which often present with severe fibrosis and pleural thickening. What are the symptoms or the symptom of empyema? Patient with empyema present with progressive respiratory symptoms including fever and chills, persistent despite antibiotic treatment, pleuritic chest pain worsening with deep inspiration or deep breathing, dry cough, shortness of breath, that is breathlessness, fatigue and weakness or tiredness, unintentional weight loss, especially in TB related empyema. In TB empyema, symptoms are more chronic, often with night sweat, prolonged fever, and significant weight loss. Diagnosis. So, for a diagnosis, early diagnosis is critical to prevent complications. And the steps in diagnosis are: first is a physical examination. There is a decreased breath sound. There is a dullness on percussion. Chest expands or chest movement are reduced on the affected side. Imaging study like X-ray chest shows pleural effusion or fluid collection. CT scan or HRCT chest detect loculated fluid, thickened pleura, and underlying lung disease. So on pleural fluid analysis through thoracocentesis. First is the appearance. It could be cloudy or purulent. Biochemistry, there will be a low glucose, high protein, high LDH. Microbiologically, gram stain, bacterial culture, and gene expert for TB if suspected. In TB empyema, pleural fluid is often exudative, lymphocyte predominant, and may be acid fast bacilli, that is a AFB positive. However, in chronic cases, fluid study may be inconclusive. There may be requiring pleural biopsy. Now the stages of the empyema. It helps us for the planning of the treatment. Empyema progress through three stages. The first stage is exudative phase. Thin infected fluid treatable with antibiotics and drainage. Second stage is fibronopurulent phase. Fluid thickens forming loculation, that is a compartment, and require chest tube or ICD for drainage or fibrinolytic drug. Organizing phase, fibrosis and pleural scarring causing lung entrapment and may require decortication surgery. In TB related empyema, the organism phase is often severe, that's the third stage, leading to fibrothorax, in which there is a thickened pleura, restricting lung expansion, that is entrapment. So for the treatment option, management depends upon the stage of empyema. First is antibiotics. It's an empirical therapy covering streptococcus and staphylococcus organism. If TB is suspected, start anti-TB drug, that is ATT, immediately. Drainage procedures. Thoracocentesis for small free-flowing collection of free-flowing fluid. Chest tube insertion for larger thickened fluid collection. Intrapleural fibrinolytic therapy used in loculated empyema to dissolve fibrin adhesions in tuberculosis. This will help to avoid surgery intervention. Video assisted scopic surgery removes remove fibrotic pleura, chronic TB often require prolonged anti-TB treatment. Standard regime is for 6 months. It can be extended to 9 to 12 months and sometimes surgical decortication due to fibrothorax. Complication and prognosis. If untreated, empyema can lead to lung abscess, sepsis, that's a blood infection in the body, pleural fibrosis, that is a entrapment of permanent lung restriction, and in prognosis, early diagnosis and proper treatment, bacterial empyema has a good prognosis. However, TB empyema often has prolonged recovery due to pleural fibrosis and lung entrapment. So let's discuss about the prevention and follow-up. Prompt treatment of pneumonia and tuberculosis, vaccination like pneumococcal, influenza and BCG for tuberculosis, regular follow-up and imaging to ensure resolution, chest physiotherapy to prevent lung restriction for TB empyema, long-term follow-up with chest X-ray and pulmonary function test is essential to assess lung recovery. So let's conclude with empyema is a serious pulmonary pleural infection that required early recognition and aggressive management, while bacterial pneumonia remains the most common cause. Tuberculosis is a significant contributor in chronic cases leading to severe fibrosis and lung restriction. In TB endemic region, a high index of suspicion for TB empyema is essential, and prompt initiation of anti-TB therapy along with surgical intervention when needed can prevent long-term disability. Thank you.